Welcome to the presentation of pneumococcal vaccine. This presentation is intended to help viewers understand dosing of the pneumococcal vaccine. Pneumococcal disease are caused by gram-positive Diplococcus streptococcus pneumoniae. It can include sinusitis, acute otitis media, pneumonia, septicemia, and meningitis. The latest recommendations from the Advisory Committee on Immunization Practices, or the ACIP, on pneumococcal vaccination established three levels of risks: average risk group, increased, and the higher risk. For the average risk groups, these are less than 65 years or older without chronic medical conditions, and there's no pneumococcal vaccine needed. For the increased risk, 19 to 65 years old who are cigarette smoker with chronic medical conditions such as diabetes, lung disease, cardiovascular disease, liver disease, kidney disease, except for the end-stage renal disease or nephrotic syndrome, but without immunocompromise, vaccine is needed. For the highest risk, for 65 years and older, or with immune-compromised conditions, including those due to the disease such as malignancy, HIV, end-stage kidney disease, iatrogenic causes such as chronic use of systemic corticosteroids, immunomodulators, transplant recipients, or functional or anatomic asthenia, vaccination is recommended. There are two types of pneumococcal vaccine: the PPSV23, which is the pneumococcal polysaccharide vaccine from 23 strep pneumonia serotypes, or the PCV13, which is the pneumococcal conjugate vaccine from 13 serotypes of pneumococcus. Please take note that both are used for 65 years and older and at high risk. The PPSV23 is meant for 65 years and older and at high risk. However, the PCV13 is not recommended for less than 2 years of age because it is not licensed for use in children less than 2 years of age. For those 65 years and older who have not yet received pneumococcal vaccine, individuals should receive PCV13 followed by PPSV23 at least 1 year later. If an initial PPSV23 vaccine was received at age 65 years or older, a repeat dose of PPSV23 is not required. For younger adults in the increased risk category, individuals should receive PPSV23 followed by PCV13 at least 1 year later, and finally a second dose of PPSV23 at age 65 years. This is at least 1 year following PCV13 and at least 5 years following the first PPSV23 dose. In highest risk category, those 65 years and older should receive PCV13 followed by PPSV23 at least 1 year later. For younger adults with highest risk conditions who are immunocompromised, should receive PCV13 followed by PPSV23 8 or more weeks later. Revaccination with PPSV23 5 years after the first PPSV23 dose is recommended for individuals in this risk group who are younger than 65 years of age and at greater risk, having a rapid decline in antibody levels. At age 65, a final dose of PPSV23 should be administered, which is at least 5 years from the previous dose for those who receive PPSV23 at 65